just shy of 9,000 beds, 8,661 beds to be exact. And that is on the basis of current survey that's very contemporary of the existing hospital system. We have about 11,500 ICU beds in our system, but that's not just for adults, that also includes pediatric ICUs. It's just shy of 11,500 when you add the two numbers up. We have new and detailed information about access to ventilators, over 7,587, not over 7,587 ventilators currently reside in our hospitals, and we have procured new ventilators, a few hundred that we were able to purchase, and we also have our own cash both through our EMSA and our CDPH sites that include an additional roughly 900 ventilators in addition to the 7,587 that I referenced. So I give you those numbers because a lot of people have asked about that information. Those are the most up-to-date and contemporary numbers. I also make that point as a point of consideration and segue to the subsequent announcement. And that is, as we manage this disease and the dynamic nature of this moment, we need to anticipate spread, but we also need to prioritize our focus. And the purpose of today's announcement is to focus on specifically what we mean by that. Most important thing, again, is to protect the most vulnerable, protect our seniors. In the state of California, we estimate we have 5.3 million Californians that are 65 years or older. Of those 5.3 million 65 years and over, we are prioritizing their safety because of their unique vulnerabilities to this virus. We also are prioritizing those with chronic conditions and prioritizing our homeless. And it's in those three areas that I want to advance some new considerations for the public and new direction for the people of the state of California. We are calling for the home isolation of all seniors in the state of California. We are calling for the isolation, home isolation of all of those 65 years and older and those with chronic conditions. We are doing so with our eyes wide open at the magnitude of what that means and the need to provide wraparound services to support our seniors in need of medical supplies, in need of meals, and the like. The team assembled behind me, and the people in this, what we refer to as SOC, our State Operations Center, of where we reside at the moment, currently have 13 task forces that are working on a panoply of issues, from logistics, from things as basic as not just food, but water, fuel, and basic supplies, to more complex issues related to workforce and the like. And so we are looking at this from a very holistic perspective and a holistic lens. We recognize that social isolation for millions of Californians is anxiety-inducing, but we recognize what all of the science bears out and what we recognize around the rest of the world, that we need to meet this moment head-on and lean in. Not isolate ourselves to this moment, but lean in and own this moment and take actions that we think are commensurate with the need to protect the most vulnerable Californians. Number two, we are directing that all bars, nightclubs, wineries, brew pubs, and the like be closed in the state of California. We believe that this is a non-essential function in our state, and we believe that it's appropriate under the circumstances to move in that direction. As it relates to restaurants, we have more nuanced concerns and considerations. Some have suggested just shutting down all of our restaurants. We don't believe ultimately that is necessary at this moment. Consideration nonetheless is to socially distance patrons within these establishments. And as a consequence, we are directing that we reduce the current occupancy within these establishments by half, and we require social distancing within those establishments. We will provide some flexibility in that space, and we could talk more about what that may look like, but in broad strokes, that is the current directive, and we will in real time absorb the capacity to potentially do more, but also try to reflect on the enforcement side of this, which I'm not concerned about, because as you had noted, with in fact, all of our directives, we are seeing a socialization in real time and strong and broad support, not only from the public health officials up and down the state, but the private sector that has done a remarkable job meeting this moment. So that's on the restaurant side. Let me just briefly make this point. There is a concern around access to food for those that cannot prepare their own food. Not everybody has kind of kitchen you or I may have. Not everybody is capable of heating their food. Now we're talking about home isolation. Not everybody is able now to go out to the grocery store to get that food. Some may have limited capacity as it relates to deliveries, but we want to expand the points of access to get those deliveries. Restaurants, by definition, provide those points of access. So having an organized construct that allows delivery of hot, prepared, and nutritious food within an existing infrastructure, we think is appropriate, again, to this moment, with the additional steps on bars, nightclubs, wineries, brew pubs, and the like. Number 3, in relationship to seniors as our top priority in home isolation as it relates to bars and new guidelines on restaurants, I referenced the issue of homelessness. This is a top concern in the state of California in the abstract. We have 108,000 unsheltered homeless individuals in the state of California. We need to meet this moment aggressively. And I can assure you, I mentioned 13 of our task force teams that are residing in this building. They are our teams just working 24/7 on this issue to get people out of encampments and get people into environments where we can address their growing anxiety and our growing concern about the health of some of our most vulnerable Californians out in the streets and sidewalks. We are in real time procuring hotels and motels to convert to appropriate sites. We have just identified, as just an example, this is not even close to the magnitude of what we are proposing, but it's just a point of consideration and a proof point to give you a sense of what we're doing. We have additional 450 trailers that we have identified that will be dispersing to critical points across this state, and we're working to address the needs within the shelters so that, again, we have appropriate distancing and we are appropriating ourselves as it relates to social mixing for those vulnerable communities as well. So that's another area of deep and disproportionate emphasis that also we are advancing as a directive. As it relates to, again, vulnerable populations, you saw yesterday we put out guidance as it relates to an executive order directing along the lines of what the CDC and others have been recommending. We codified that in the state of California on visitation in our senior facilities, our skilled nursing facilities, our assisted living facilities. We now are tightening those directives to just end-of-life visitation, and that includes hospitals, not just congregate living facilities in the state. So that is also part of what we're advancing here today. So that gives you a sense of some of the current thinking of our healthcare professionals. Again, a number of them behind me. We have our finance team here and others in this building. We are gaming out the financial impacts, not just to the state's budget, but with disproportionate focus on families and individual budgets. This is a very different challenge, a very different crisis, and we need to meet this moment even differently than we did in the 2008, 2009 years. We have to really focus on individuals. So looking at our unemployment insurance, our disability insurance, looking at how we can complement what was done at the federal level. We're also sharpening our focus on what we request of the federal government going forward, as we believe the extraordinary work that has been done by Speaker Pelosi and her colleagues, and we hope soon by the United States Senate, can be complemented with even more support that we think is necessary to meet this moment. In more parochial, for some more pedestrian issues related to our work with the California legislature. We're in real-time conversations with the legislature about our current budget and how we'll process the concerns and anxieties people have about quote-unquote business as usual, an environment where business cannot be as usual, and we'll be making announcements on that in the next number of days, probably in the next number of hours potentially, and certainly tomorrow. On the issue
correctly. It'll be so wonderful. I just had a phone call with very impressive people, the biggest in the world of stores and groceries and all. And I'll give you the names. Dave Clark, Whole Foods. Mark Clow, CEO of Campbell's Soup Company. Brian Cornell, CEO of Target. Randy Edeker, Chairman and CEO, President of Hy-Vee. Jeff Hamerning, CEO of General Mills, great company.
Process has been about. And you may have noted just a few days ago, we initiated, I put some information out on the initiation.
Todd Jones, CEO of Publix Supermarkets. Donnie King, Tyson Foods. David McLennan, Chairman and CEO of Cargill. Rodney McMullen, CEO, Chairman of Kroger, big company. Doug McMillan, CEO of Walmart. He's been fantastic. Doug was here, as you know, on Friday, and he watched the market go up 2,000 points. On Friday, it went up 2,000, almost 2,000 points. Todd Vasso, CEO of Dollar General Corporation. And Vivek Sankaran, President and CEO of Albertsons. So these are all phenomenal companies. These are great companies. We had a long conversation with them, and they're going to work 24 hours round the clock, keeping their stores stocked. I would like to say that people shouldn't go out and buy. We're going to all be great. We're going to be so good. We're going to do what's happened with the Fed is phenomenal news. What's happening with all of these incredible companies is phenomenal news. But you don't have to buy so much. Take it easy. Just relax. People are going in and they're buying more. I remember, I guess during the conversation, Doug of Walmart said that they're buying more than they buy at Christmas. Relax. We're doing great. It all will pass. The folks that we spoke to, they've done a fantastic job. They're going to meet the needs of the public. They're going round the clock if they have to, and they're committed to the communities where they're serving and which they serve so beautifully and have for a long time. And they're buying a lot of additional things to sell. But again, they actually have asked me to say, could you buy a little bit less, please? I thought I'd never hear that from a retailer. All of them are working hand in hand with the federal government as well as the state and local leaders to ensure food and essentials are constantly available. And they'll do it. There's no shortages. We have no shortages other than people are buying anywhere from 3 to 5 times what they would normally buy. It's going to be there for a long time. We're doing numbers, and there's a pent-up demand that's incredible. When this passes, when this goes through, you're going to see numbers, I predict. I guess I'm allowed to predict just like Wall Street people are allowed to predict, and they're pretty much in agreement. You're going to see there's a pent-up demand like a lot of people, including me, haven't seen before. But this has to get through. They know they're getting through the crisis and will require an all-of-America approach, and that's very important. They're committed to remaining open during this crisis, totally open. They have to stay open. Those stores have to stay open. They supply our country. Our supply chains in America are the most powerful in the world, and they're all working very hard. They're working around the clock, and the stores are stocking up at a level that's beyond Christmas time, and it's great. It was very reassuring speaking to these people. They have it totally in hand. There's no need for anybody in the country to hoard essential food supplies. They said to me, could you please tell them, just go and buy, enjoy it, have a nice dinner, relax, because there's plenty. But you don't have to buy the quantities because it's hard to refill the stores on a basis as rapid as they're refilling them. And we are using the full power of the federal government to defeat the coronavirus, and we will do whatever it takes, and we're doing, I think, really, really well. A lot of good things are going to happen. I want to thank all of the people standing behind me. You know, these are phenomenal people, and we have some of them right over here, but the people behind me have been working round the clock, and they're doing an incredible job. We see what's happening. We see what's going on in other countries. We're looking we're learning from watching other countries, frankly. There's a very contagious It's a very contagious virus. It's incredible, but it's something that we have tremendous control of. I think very important to young people, people of good health, and groups of people just are not strongly affected. Elderly people that are not well or not well in certain respects are really a dangerous group. We have to watch them. We have to protect them very much. We have to really watch over them and protect them because they are very vulnerable. And with that, if it's okay, I'm just going to go and make some calls. I'm talking about Federal Reserve. I think it's a tremendous thing that took place just now. I didn't know I would be surprised on a Sunday. I don't know if that's ever happened on a Sunday before, but I would think there are a lot of people on Wall Street that are very happy. And I can tell you that I'm very happy. I didn't expect this, and I like being surprised. So our Vice President, who's doing an incredible job, is going to take over, and I will see you probably tomorrow. Thank you very much.
Bars and restaurants closed.
Well, thank you, Mr. President, and good afternoon. With more than 2,900 cases of coronavirus in 49 states across the country, I want to assure the American people that this administration, all of our partners at the state level, and local health officials have no higher priority than the health and safety of the American public. And at the President's direction, we will continue not only a whole-of-government approach, but as we'll discuss today, we'll continue to build on a whole-of-America approach to confront the coronavirus across the country. The health experts continue to confirm to us that based on the latest information, for the American people as a whole, the risk of serious illness remains low. But because the risk is heavily weighted to the most vulnerable, to people with immunodeficiencies and to people who are elderly with serious underlying chronic health conditions, our administration, and I know state administrations, will continue to focus on the most vulnerable, and we will continue to urge every American to be vigilant in practicing good hygiene, taking the advice of the CDC and local health experts to keep those most vulnerable safe. I know I speak on behalf of the President and our entire team when I say how grateful we are for governors all across the country and the seamless partnership that we have forged with them and with state health officials, with our federal team. I spoke today to Governor Pritzker of Illinois, and we are in continuous communication with governors a phone call away. They know that they can contact us and address even the smallest need, because as a former governor, I know firsthand that when it comes to health challenges in America, our states are on the ground in the lead, our local health organizations, and we've built a great partnership. We also want to express great appreciation to the American people. Not surprisingly, it is inspiring to see the way tens of millions of Americans are responding with compassion, with common sense, and we want to express particular gratitude to communities of faith that participated in today's National Day of Prayer. We've seen places of worship implementing policies to keep those most vulnerable safe, and also we're seeing communities of faith already stepping forward to support and to encourage those most vulnerable. I heard tell of a church back in Indiana that's actually no longer having services till April 10th, but in the meantime, they'll be offering daycare to the children of healthcare workers in central Indiana. And churches all across the country are taking the opportunity to reach out and put feet on their faith, and it's truly inspiring. As the President mentioned today, he spoke today to leaders in the grocery store industry and where people buy our food, and we heard and we're reminded that America has the most efficient and effective supply chain in the world, and it's working just fine. As the President said, he received a commitment from those grocery store executives that stores will stay open throughout the days that lie ahead. We were told that hours may be reduced to allow for cleaning and to resupply, but American families can be confident your local grocery store is going to be open, it's going to be well supplied, and they specifically asked us to encourage Americans just buy your weekly needs in grocery, because the grocery stores will remain open. Also, very movingly, those same executives all reiterated their commitment to continue to support local food banks in the way that our grocers continue to do around America. Tomorrow, the President and I will be briefing all the nation's governors, states and territories, and the District of Columbia. We'll be speaking about the progress that we're making, and we'll be speaking to them specifically about our widening partnership on expanding testing to the American people. So allow me to speak to that issue, and then I'm going to recognize Admiral Brett Kouar, who will describe for us the excellent work the Public Health Service is doing. Dr. Birx will describe the importance of the new national public-private partnership for diagnostic testing that is going to open the door to thousands of more tests in real time for the American people in the days ahead. First, some fundamentals. As the American people know, testing is now available in all 50 states. Either state labs are either conducting the tests themselves or the CDC is processing tests. They're using the traditional manner of a manual test that allows for 40 to 60 tests a day. It is among the reasons why the President several weeks ago tasked this group at the White House to reach out to commercial labs around the country and forge that public-private partnership that would bring the high speed, or more accurately, the high throughput testing for coronavirus available in real time. And based on the unprecedented speed of the FDA, which last week approved high throughput coronavirus testings for Roche and Thermo Fisher, we will now have access in the days ahead to more than 2,000 labs across the country that have the equipment today to process coronavirus tests much more rapidly and a much higher volume for the American people. In terms of delivering those services, more than 10 states, in addition to CDC labs, and public health labs, and labs that states can now authorize in their states, more than 10 states have implemented their own drive-through testing sites. And we want to commend New York, Colorado, Delaware, Washington State, Texas, and others that have implemented these on-site places where people can obtain tests. Most are using the current CDC testing, the manual testing, but we are working closely with our governors, as you will hear momentarily, to make sure that the new testing regimen is available for their remote sites as well. As I mentioned, as of Monday, we will have more than 2,000 labs coming online with the high-speed testing, and we are connecting states to those testing methods. We're also working with a number of retail partners to add to the work that states are doing around the country, working to set up parking lot testing centers outside of stores, and Admiral Brett Kouar will detail the progress that we've made over the last 72 hours. Following the President's declaration of emergency, the Admiral and our Public Health Service have forged a partnership now with FEMA, made possible by that declaration, and they've reached out to all 50 states to create a process that will enable all Americans who need to be tested to go to a community-based testing site outside of usual healthcare facilities. The focus of these tests, as Dr. Birx will describe momentarily, will be on those most in need. A priority will be placed on healthcare workers and first responders who are out there coming alongside people that are being impacted by the coronavirus. We want to make sure they have access to the testing as a priority. And then Americans 65 or over with a cough or a fever or other symptoms will be prioritized over other tests that are extended. As I mentioned, Admiral Kouar will describe the progress that we've made in just a few moments, but we're going to continue to work very diligently, hour by hour, day by day in the days ahead, to expand testing around the country and access to this extraordinary and unprecedented national public-private partnership for diagnostic testing. With regard to testing, as we expand testing, we're so pleased that Congress joined with our administration to make sure that cost is never going to be a barrier to anyone getting a coronavirus test. As you recall, several weeks ago, the President directed a change in our Medicare and Medicaid programs to ensure that coronavirus testing was included. Health insurers were brought in. They all agreed to waive copays, but because of the good bipartisan work done in the House of Representatives, now all coronavirus testing is free, and it's free for every American, including uninsured Americans. And we continue to urge passage of the legislation that will be considered by the Senate this week. Let me say one final word about the testing issue, and that is that we, as the President often says, we're all in this together. And it's absolutely important that as we expand testing resources across the country, beginning by prioritizing the areas that CDC and our state leadership tell us are most important. It's important that the tests are available for people that are most in need, and for our healthcare workers and first responders that are helping them and supporting them. As Dr. Birx will describe, the testing that is available should only be done if for any reason you think you may have the coronavirus. We encourage people to consult their doctor, and if you're symptom-free, we encourage you to work with us to make sure the testing is available for people that are experiencing symptoms. It's extremely important that we have the continuing cooperation of every American as we expand testing and make it available during this challenging time in the life of our nation. With that, I'm going to ask Dr. Birx, I'm going to ask Admiral Brett Giroir, the Public Health Service and leader of this great commission corps behind me, to come up and describe the extraordinary work that they have done over the last 72 hours and will be doing each and every day in conjunction with our states to expand testing to community-based testing across the country for the American people using this new public-private partnership diagnostic testing. Admiral?
Thank you, Mr. Vice President, and thank you for your personal interest and support of our team over the last 72 hours as we worked on this critically important project. So as the Vice President said, over the past 72 hours, we have developed and are beginning to implement now a process and a program of testing that will enable